Thank you, first of all, Anita, for letting me join y'all today. I'm excited to be here, and I hope that you'll get to take some things away from this that get to learn and kind of find some exciting things in here. When I was trying to think about what I wanted to present, because there's so much to think about in veterinary medicine, I really was thinking about kind of what we're going through right now and maybe some interesting diseases or things like that that you might be able to share back with your students or actually even your family, things like that. So there are going to be some pictures. So if you've got like a queasy stomach, you can always turn away, but hopefully you'll learn some things today that you may not have known about. And I hope that I can also really encourage everybody to think about how we can get kids, your students, everybody like that, more involved in veterinary medicine. There's so many different career paths out there, and I'm only going to be speaking to a very narrow range of things today, but it is a super exciting career. So a little bit about me. I hate to date myself, but this month will be 20 years since I graduated from Colorado State University. So I've been practicing medicine for 20 years, 8 years in mixed animal practice, and the last 12 years in small animal practice. And I'm here in Georgetown, Texas, and I oversee the Banfield hospitals, veterinary hospitals in Austin and San Antonio. So I get to see a lot of different cases, meet a lot of different doctors. We have 73 doctors in our market here, and just some incredible people to work with. So without further ado, I'm going to make sure I can share my screen with you. And there we go. And thumbs up if you can see the screen that says veterinary medicine. Mom, can you give me a thumbs up? Okay, very good. All right, so today we're going to talk about zoonotic diseases, and we'll go into the definition of that, but these are diseases that can be spread from animals to humans, and there are a lot of those out there. But before we start that, what I wanted to do, let me get over here. All right, so what we'll discuss today is in this time of a pandemic, I'll be honest with you, I hadn't really thought about what an essential service or an essential business was until COVID showed up, right? And you know, what businesses are considered essential, what businesses are non-essential. But in most states, veterinary medicine is considered an essential service. And you know, we're open during that crisis. We're there during hurricanes and floods, and also during pandemics, because it's really important piece of how we protect public health. We're going to talk a little bit about preventative care. We'll talk about zoonosis, like we talked about a minute ago. And then I'll just give you a very short list of some zoonotic diseases that we see on a regular basis, and show you some pictures and talk through what that looks like. And then last but not least, we'll talk about COVID in your pets. Are there things that you need to be concerned with? Is it a zoonotic disease? Things like that. And definitely want this to be interactive. So if you have any questions, I can't see the comment bar, but Anita said she'd be watching that so we can answer questions as those come up too. All right, sorry about that. I'm hitting the wrong deal. All right, so veterinary medicine as an essential service. So veterinary medicine, veterinarians are kind of the front line when we think about our food sources that come into the United States, and also in our processing plants, things like that. So we're the first line of defense to really be able to check for, is there an emerging disease that's coming across our border? Is there something in the packing plants that might be a concern to humans? So some of those things that we look for, tuberculosis is something that cattle can get. And I have a doctor working for me right now in New Braunfels, and she just came from, she was a USDA vet, and she was on the border of Mexico and Texas. And she had to stop a lot of cattle from coming through that were showing signs of disease. And so she's protecting our food source when those animals come across. So if they're not healthy, they don't cross and they don't go into our packing plants for to be food that we'll have later. There's a lot of things going on with our food sources right now. You know, there's we've got a disruption in the packing plants because we've got ill people, and so those have kind of started to shut down a little bit. So this is going to be a really important piece of where veterinarians partner with the human health side to make sure that our food supply stays whole and that we have quality food products going into our grocery stores and to our restaurants. So this is a big piece, and this is really where veterinary medicine started. It was not only to protect the animals and make sure that our working horses and our cattle and everything were safe, but also to protect the public as well. Preventative care is a huge piece for me. It is probably my biggest passion, because I truly believe with humans and in animals, if we can do preventative care, we can extend the life of our pets and also help prevent suffering and pain and other things that can just really make life miserable for them. We're also an essential service during a crisis like this, because we are still seeing dogs that are hit by a car, or maybe even a cat that swallowed your hair bands. We see that all the time. We'll see the little hair bands in an x-ray and have to go in and do surgery. And those things can't wait. If we were to say, hey, we need to wait till we start seeing a relief in COVID, these pets will suffer and could potentially die. And chronic care too. I don't know if any of you have ever had a pet with arthritis or obesity or something where they needed medication to be able to feel comfortable. We don't want them to go long periods of time and be uncomfortable, so we still need to be able to provide that chronic care services for those patients that need us to. And then the last two things are really important. I hate to say this, but about 4 weeks ago, we had to put my 14-year-old pit bull down. And I can't imagine not having another veterinarian available to be able to help me through that time. And so we are there for the end of life things that come up too, because it's really so important. We're there for their entire life. We need to be there for the end as well. So that's why we are an essential business. And there's many other reasons, but that's really the ones that stood out to me. And so with that, we'll talk a little bit about preventative care. And with this, preventative care is about all these different things we'll talk about with zoonotic diseases and how we can help prevent those. But also think about this. During this time, we've got a lot of people that might have lost their job, or they're worried about getting sick from COVID, or many different things that they're struggling with during this time. Preventive care can give peace of mind knowing that your dog is vaccinated against deadly diseases, that they're dewormed, that they have heartworm prevention, all of those different things. So it really helps owners with peace of mind. The other thing that we talked about is preventing disease and also lessening the severity of the disease is what preventative care can help with as well. And then we'll go right into the public health sector of it with the zoonotic disease transmission and how preventative care can help prevent zoonotic disease spread. Sorry, you guys, there we go. So like I said, zoonotic diseases, this is any disease that can be transmitted from an animal to a human, okay? So it can show up in many different ways. It can be a virus, it can be a bacteria, internal parasites, so ones that can get in your intestinal tract or in the lungs, and then also external parasites, ones that can be on the skin, and then also can be fungal. And there's other zoonotic diseases too, but those are the big ones, kind of categories that we see. They also can be spread in many different ways. So direct contact, so for instance, like a bite wound, saliva going into the skin of a human can pass from an animal to a human, certain diseases. Indirectly, when you think about anything that can, like a surface, for instance, that can carry germs, or, like someone sneezes and another person goes over and touches that surface, that is now an indirect ability to pass on that infection. The other thing to think about is we have what we call, and that would be kind of like a fomite, but also we have the vector, and that could be a mosquito, a tick, anything that really can go bite an animal, pick up the virus or the bacteria, whatever that is, and then go bite a human. And so Lyme disease is a perfect example of that. And then last but not least, it's our foodborne illnesses. So these can be zoonotic. If you have animals that are out in a big pasture of like spinach or your romaine lettuce, things like that, that's how E. coli can be spread. And so that can be through feces that gets on our plants. And if they're not washed really well, we can get a disease that way too. So those are the big categories. And then what we'll do is we're going to just, like I said, go through a really short list of some of the things that we see on a regular basis in the hospital. So I think this is a familiar disease to you guys. So rabies is very, very common as far as a vaccination goes. It's easy to prevent, and a vaccination, depending on where you live, usually it'll be either a year-long vaccine or it could be up to 3 years. And it really depends on kind of what your state and local ordinances say about that. But how rabies is transmitted is most often through direct contact. So you can see the little dog in the middle of the screen there. This dog is drooling, looks a little bit kind of subdued or lethargic. But let's say this dog bites a human, and you can see the bite wound over there. What happens is that virus is now in the system. And what happens is the virus starts to go into the nervous system. So it actually follows the nerves up to the brain. So you think about a lot of bacteria, viruses, things like that, it gets in the bloodstream. Well, rabies can too, but it likes to follow the nerves. And so it's kind of this slow process to get to the brain. It can be from weeks to months before an animal even starts showing signs of rabies from the time that they're bit. And so once that virus gets to the brain, what happens is it starts breaking down the brain tissue, and then that's when you'll start seeing the signs. And you'll see an animal, you might see a skunk, for instance, be out outside during the middle of the day, right? So they're out and you're seeing them there and they're just laying there. It's not normal for them. They're usually nocturnal. They don't usually come out during the day, but this rabies disrupts the way that they're thinking and their normal habits. And so they'll be acting different. Drooling is definitely a sign, and this might also date me too, but for those of you that remember Old Yeller, you know, you see this really vicious dog, right, that comes out of this dog house and it's barking, and you know, he has rabies. That is one way an animal can show up as being very aggressive. But the ones that I've seen are ones that are actually very subdued. They seem to be almost blind at times, stumbling around, and just not acting normal. So it's not always an aggressive animal that can, you know, show up as having rabies. So with this, let's say a person does get bit, but they don't do anything about it. And so this disease starts to progress, it goes into their brain. They show similar signs. So definitely because the brain is being impacted by this, there will be some delusional type of things happening. They might be stumbling, having trouble speaking, headaches, things like that. But the other weird thing that humans have that we can't really identify necessarily in dogs is hydrophobia, or the fear of water. They say that a lot of people show up that way that end up having rabies. So I thought that was kind of interesting because, and I don't know if they know why that's the case or anything else, but it's just somehow that it's impacting the brain. So when we have an animal come in that we're suspicious of rabies, the unfortunate thing is the only way to really test for this is to take a brain sample, because that's where the virus is going to be living. And so we do have to euthanize that animal, and we send off that brain tissue, and the lab does what we call a fluorescent antibody test. And what it does is it sends antibodies, this fluorescent antibody, into the brain tissue, and it lets it sit there and kind of incubate with the brain tissue. And then what happens is that antibody attaches to the antigen of the rabies virus in the brain. And under the microscope, what you'll see are these little green fluorescent bodies all over in the brain tissue when you have a positive sample. And it's pretty distinct when you look at the samples side by side with a negative rabies and a positive rabies. This green is very obvious. And so that's how we test. And I thought I'd give y'all a quick story about my run-in with rabies, because it was definitely interesting. So when I was in Roswell, I practiced there for 8 years, and I did, like I said, mixed animal practice. And one afternoon, we got an emergency call. So it was after hours, emergency call, and I didn't have anybody there to help me treat this. It was a calf, so not a cat, but a calf, C-A-L-F, that had come in for not being able to swallow very well, and just had a little bit of drool. And you guys are in New Mexico, so you know we've got a lot of thorns, we have a lot of cactus, things like that. And so that's what we typically see when an animal's like having trouble swallowing, stuff like that. So I put on my gloves, but I'd also asked my husband to help me out on this because I needed someone to hold. And so he was kind of holding the mouth open for me, and I reached in. I was looking for, you know, a thorn or a cactus, or even like a piece of metal. Sometimes, you know, livestock will go around and kind of nibbling on the ground. Couldn't find anything. So he did have a fever at the time. So we ended up giving antibiotics and some pain medication. And when I came back in that next morning, he was stumbling around, very out of it, acting like he was blind. And immediately I thought, oh, crud, this calf probably has rabies. And so we ended up, he continued to deteriorate throughout the day. We ended up euthanizing him and sent brain tissue in, and sure enough, he was positive for rabies. So my husband and I had already been vaccinated in vet school for rabies because we, you know, handle pets all the time. But my husband had to go through the full series of shots, and I had to just do some boosters. But it was quite the experience. And you know, the chances of us getting rabies from that, with working with that calf, probably pretty low. I didn't have any cuts on my hands or anything like that. But you just don't want to take chances with a deadly virus like this. And so not all hospitals carry the prophylactic rabies vaccines or injections. So usually the state veterinarian or the state health department has to get those sent to the hospital that you're at. So it's not a common thing that people get vaccinated for rabies unless you're in a high risk situation like a veterinarian, or in areas that you're working that could be very high prevalence of rabies. So that was kind of my story with rabies. And my husband just after that elected not to help me very much with after hours calls since I put him in that predicament. But anyways, a little bit more about rabies too. I thought you might see that this is interesting. So probably about 10 years ago, maybe a little bit longer, West Texas was seeing a really high incidence of rabies happening in wildlife. And what was happening is that then the wildlife would be going into backyards and things like that. And then we didn't know if the dogs had been exposed to this rabid skunk or raccoon or fox, whatever that was. And so, and I can't remember exactly why we were seeing such a big increase in rabies at that time. But what they decided to do is drop oral rabies vaccine out on the ground. So these packets that you're seeing there on the left-hand side, those are packets that were dropped from a plane or helicopter in areas where we were seeing high levels of rabies. And then our hope is that the wildlife would go, it's flavored, so it attracts them over there to it. But hope is that they go and they eat that and give them some protection against rabies. And sure enough, very shortly after that, probably, you know, it took several months, but we did start to see the drop off in rabies in that area. And so this is something that they use when we do start to see a spike in rabies in the wildlife population, because it does impact us. It impacts our pets. It can impact us. And so this isn't a tried and true method because, you know, we can't predict who's going to eat it or how much they're going to eat or anything else, but it sure does seem to help in those areas that have that little spike that we see sometimes. And then the next two pictures, kind of the worldwide projects that are going on to help fight rabies. What we do know is there's about 59,000 human deaths from rabies each year, and that is a lot. And we see this mostly in Africa and Asia, and the unfortunate thing is most of these are from dog bites, and most of these are from children that are dying from this. So they don't know that a dog has rabies, they go to pet it, the dog bites them, and then they don't realize that, you know, that they need to go get help for this, and then end up getting rabies and passing away from it. So the picture on the far right-hand side, the young lady that's giving that vaccine, her name is Dr. Kelly Cooper, and she used to actually own a practice in Lovington, New Mexico, but she works with me now in at Banfield. And Banfield is also the parent company that we work for is Mars, so the chocolate company, but actually their veterinary side is larger than their chocolate side. But we get the opportunity each year to apply for global community outreach type of scenarios, and this is one that she had applied for and got accepted, so she got to spend 2 weeks over, and I don't know if I'm pronouncing it right, but Goa, India. And this area has a lot of stray dogs running around and lots of rabies. And so what they did is they have a large number of people that go and catch the dogs for them, and then the veterinarians go out and vaccinate feral, wild, or domesticated dogs. And so there were pictures of her on the beach, there were pictures of her in the jungle giving vaccines, and I think, if I remember right, they said they vaccinated over 50,000 dogs in a 30-day time frame. And so lots of things going on in the world trying to help decrease the number of deaths from rabies, because it is very, very preventable. And so I'd encourage you, if you have pets, please be sure that they get vaccinated on a regular basis, because, like I said, easily preventable, but deadly if they don't get the vaccine and they get bitten. There are a few cases out there where humans have survived a rabies bite, but is very, very rare. So for the most part, this is a deadly disease once you start showing signs of rabies. Sorry, keep hitting the wrong thing. Okay, so this is our first zoonotic disease that we're going to talk about. So again, zoonotic transfer from animals over to humans. And this little monster right here is the canine hookworm. And so you can see, here's the teeth, and these have little hooks on them too that you might not be able to see. This is a microscope view of a canine hookworm, and he is actually just as gross as you would think he would be. A dog will ingest a hookworm, so maybe your dog's out at a dog park or you're at the park and runs around and sniffing around and might sniff other dogs' poop, and the larvae of the hookworm can actually get on their skin or their mouth, and those hookworm larvae can be ingested. And then what happens, it starts to grow into this ugly thing that you see. And then what this adult worm does is it attaches onto the intestinal wall, and it actually hooks into the intestinal wall. And when it does that, it just starts chewing and breaking down the tissue in the intestinal tract. And when that happens, it also releases an anticoagulating type of substance. So as the blood vessels break, it actually keeps the blood from clotting. And so these pets, what will actually happen is they'll come in and they'll present to us very lethargic, gums will be really pale, and then they'll be anemic, so the red blood cell count will be really low. And this isn't the picture of one of my patients, but the one I'm going to tell you about is the Spuds McKenzie dogs, the bull terriers, had a little puppy that had come in, and the owners only wanted to do vaccines when he came in for his first booster. And by the time it was time for his second booster, they were carrying him in, and he didn't even want to walk. He was skinny. very, very lethargic. Gums were pale. So we ran blood work. His red blood cell count was so low, he had to have a blood transfusion to even come close to surviving. And when we ran the fecal, he was loaded with hookworms. So thank goodness we were able to get a blood transfusion to him. He did survive, but if he hadn't got the blood transfusion, he very well may not have. So then what happens here, you know, once they have hookworm disease, if they have a small worm burden, so just a few worms in there, they might die off in the intestinal tract, but they're also in the meantime shedding the larvae stages of hookworm out into their feces. And when that happens, that can get into your backyard or parks or things like that. Like I said, if you need to turn your head, you can. But this is a foot of a gentleman that has the hookworm larvae crawling through the skin. So it's just migrating underneath the skin here. And it'll eventually die off, but it causes a lot of damage in the process of this. And so this isn't super common, but it is something that can happen for sure. And the other piece of it that's very rare, but I want to be sure that you know about, is that larvae can get migrating through the skin so much it can actually go up to the eye and cause eye damage, and it can also go into your internal organs as well. And like I said, very rare, but it is still a possibility. So the reason I really want to hone in on this is that this is also preventable. Deworming your dog on a regular basis, super important, because the other thing to think about is other ways that hookworms can be transferred to another dog is through the placenta. So if a mom dog can pass it through the placenta, and also through her milk to the puppies. So sometimes puppies are born with hookworms and they were never exposed to it on the ground or anything else. So important to, you know, make sure that all stages of life are being dewormed on a regular basis. A lot of your heartworm prevention also has hookworm medication in it. So that's the other good thing. You're protecting against a couple of diseases there. All right. So scabies is going to be one of our ectoparasites. So on the outer skin there, and I'll kind of show you a picture of a sarcoptic mite. So here, this is a sarcoptic mite sitting right here. We got the head here and the little legs out here. And this little creature can do some damage too. And it likes to hang out in the skin, but not just hang out there. It likes to burrow deep into the skin. And when that happens, it causes a severe itchiness reaction for a dog, and they will scratch so much that their skin will get really thickened and they can lose almost all of their hair. And it's intense. I mean, how itchy they are. I mean, they just cannot get comfortable. And you might have heard of demodectic mites too. Those are not as itchy. So it's a mite that looks similar to the scabies mite or sarcoptic mite, but it's not near as itchy because it doesn't burrow into the skin, and it's not a zoonotic disease where it gets transferred to a human. This one here does get transferred to humans if we're not careful. And so I did put up a PG rated picture here because unfortunately these sarcoptic mites likes moist and dark areas. So they like to go into crevices. So under armpits, in between your legs, anywhere that you've got little folds, these mites like to kind of hang out there. And so I've had a couple of patients with sarcoptic mites, they had just adopted them. And one of the first questions I always ask the owner is, are you itchy at all? And a lot of times I'll get this embarrassed look like, yes. And we definitely have to get them sent over to the human doctor to help take care of that. Good news is there is treatment for this. We used to have to use a really nasty lime dip and a mitaban dip, things like that. It had really bad smells about it, and it kind of not good for the environment or anything else. But now there's some oral products that you can give. Bravecto is one, but a lot of things out there that can really help a dog feel better very quickly. So what I would say about this, there's not a vaccine or anything you can do to prevent this. What I would say is if you start to see any hair loss or your dog is really, really itchy and losing hair, really important to get them in quickly because this is zoonotic, very contagious to humans and to other pets as well. All right, so this one, Leptospirosis, is a bacteria, and show you a picture of it really quick. This is what it looks like under a microscope, and it's actually a spirochete type of bacteria because of the spiral that you see that the bacteria looks like. And this one does have a vaccine for it, but how it's transmitted is what you'll find it's found worldwide. It's in soil, it's in water, standing water, things like that. And so deer can go over and drink some water, they go down the way, they urinate, and they can actually help spread lepto from place to place. Actually, a lot of wild animals can, raccoons, foxes, you know, skunks, deer. And we see a lot of it here in Texas because we do have quite a bit more water standing and we've got a lot of shade and stuff like that. And so what will happen is your dog might go over and start drinking out of a puddle where you have standing water or something like that. And if there's lepto in there, that bacteria starts to replicate inside and can cause some pretty significant signs. So usually what we see when a dog with lepto comes in, we'll see them, the owner will tell us, you know, he's just not wanting to eat as much as normal, definitely lethargic. And then also there might be some changes in the urination habits. So it could be actually more or it could be less than normal, depending on how far in the stage of disease we are. So what the bacteria does is it actually damages the kidneys and the liver. Hold on, I'm gonna grab a drink really quick because I'm about to cough, sorry. So it can damage the liver and kidneys and can cause significant issues with that patient. And so then if a person, for instance, was also in that same water, let's say with recreational swimming or things like that, they can also get lepto. But the reason it's a zoonotic disease is because, sorry you guys, is because, for instance, if the urine of that pet that is infected with lepto, if for some reason the urine were to splatter in your face and get in your eye or in your nasal passage or in your mouth, there is a slight possibility that you could get lepto too. As veterinarians, we have to be very, very cautious because sometimes we might be thinking we just have a patient that has kidney disease, when in all actuality it might be lepto, and we're cleaning their kennels and stuff like that, so we're exposed to their urine a lot more. And so if we ever find a positive case of leptospirosis, we do send our associates to the doctor just to make sure that if they need to be on any prophylactic antibiotics or anything like that. And that's the good thing. If you catch leptospirosis early, you can treat with antibiotics and really help that patient feel better pretty quickly. However, if it goes on for quite a while, the damage to the liver and the kidneys sometimes is irreversible and can you know, be a lifelong issue that pet's dealing with. So it is something, I didn't see a lot of it that I know of in New Mexico, but here in Texas, we do see this quite a bit. Actually, A&M was doing a study on it when I first moved down here, and a lot of patients that we were just seeing with a fever and some kidney issues ended up being lepto positive. So we were sending a lot of samples in at that time, and I had no idea that it was so prevalent down here. So that is leptospirosis, and our last one that I wanted to talk to you about before we go into COVID in pets. So let me get to the next slide. So I'll let you kind of read through the headlines real quick because I have a feeling that you've probably been seeing quite a few of these pass through your news feed or on TV. So I'll give you just a minute. All right. So what we are finding is that and I first want to say too, I am definitely not an expert in COVID whatsoever. So what I can tell you about is what I know on the human or on the animal side of things. But I'll be honest with you, I think we can all say I'm not sure there's anybody an expert in COVID yet, because it changes every day, right? We find out more and more things about this virus every day. This pug that's sitting up here, I had to add that to my slide deck because that came up over the last couple of days. And so this is an ever-changing thing for us, and the education that we're giving our clients, we just let them know that, you know, that things may change, but this is what we know right now. So I'll start with the 2 pet cats that test positive for COVID in New York. So we know for sure that both of those cats came from households where they had a positive human that had COVID first and actually gave COVID to the cats. And those cats only showed minor respiratory disease and then recovered quickly. So very mild symptoms. And we do know that that was passed from human to the pet versus the other way, not from the cat to the human. I'll put these 2 together, the 2 from the Bronx Zoo. So it started out, it was just 1 tiger that tested positive. As they've gone along, they've tested more of those cats now. And so now 8 cats at the Bronx Zoo showing positive for COVID. And what they have found with this one is that their caregiver, so the zookeeper for that particular area, actually had COVID and was positive and gave those large cats the virus. And same for them, they had mild respiratory symptoms, a little bit off of their food for a couple of days, but then seemed to recover fairly quickly. So the good news is it seems to be very mild symptoms so far in our feline patients. And then I'll go over to the canine side of things. This one down here, the one that says patient's dog test positive, it's in the black. That one is actually from Wuhan. It was the first dog that tested positive, and that was in China. And I do believe that that person was positive for COVID and gave it to the dog. And the dog, I think, was like 17 years old and ended up passing away from something different than COVID. But this week, we had our first in the United States, our first dog test positive too. And this one's an interesting case because it was actually, this family was part of a study with Duke. So Duke was putting on a clinical study. And I believe the wife, if I'm not mistaken, was a pediatrician. But her family started showing respiratory illness and they got really sick. And so they were part of this study. They came in, they tested all the humans in the household and all of the pets. And so 3 humans tested positive. So I think it's the wife, husband, and maybe the son tested positive, where the other child did not test positive. And they tested 2 dogs and 1 cat, and only 1 dog showed positive. And we don't know a whole lot about this except that the pug started to be a little bit off of his food for a couple of days and just acted a little bit tired. So nothing major, a little bit of a cough, but if you own a pug or you know pugs, they sometimes cough and choke a little bit just because of the conformation that they have. So the owner wasn't really sure if that was just a normal thing or not. So just mild symptoms and then quickly recovered after that too. So all of these that I have posted here and what we know of so far is it's a human passing COVID on to an animal. So this next slide that I have,
Jenna, there are a couple of questions, Jenna, in the chat box that just popped up.
Let me see if I can find it really quick. Hold
on. I can read them too if it's easier. Is the test kit the same for vet, animals, and humans? And the question is, if animals do not get COVID, can they still be a carrier that you know?
Okay, no, great questions, and we'll kind of cover that. So testing wise, from my understanding, is that they, in humans, it's nasal swabs, oral swabs, and I think that they took blood and oral swabs, so like mouth swabs of the animals in the pug household. I'm not exactly sure how they test the big cats in the Bronx Zoo, but I think that that's what I heard on the dog side of things. And so, and as far as the way that they test, once it gets to the lab, I have no idea. I don't know if they're testing for antigen, if they're testing for antibodies. I'm not sure about that. So I think we're going to learn a whole lot more about this soon. What I can tell you is that, so Antech is the big laboratory that we use for a lot of our tests, not COVID related tests, but just tests in general. And they have tested over 2,000 pets that were in households where people were positive. And I think at this point, or the last time that I heard, there was only 10 samples that were showing up positive out of the 2,000. And all of those patients were just mild, all of the animal cases were just mild symptoms. And so, again, I think we're going to learn more about how that testing is going to look. Is there, like I said, different types of tests depending if you're human or animal? I'm not sure. And then, Anita, can you repeat the other question for me real quick? I'm sorry.
If animals do not get COVID, like if they don't, can they still be a carrier?
Yeah, so good question. So how I would view this, so the virus tends to seem to stop with them, right? So it doesn't look at this point in time that they're spreading the virus like through their nasal passages, things like that, from to another animal or to humans. But here's the part that I really want you to take home, and it's in this last piece here, is it doesn't mean that if you are COVID positive and you're sneezing on your pet, or that pet is very much exposed to the germs that you might be spreading, that it can act as a fomite. So it can be that carrier. It can sit there on the hair of the patient. And so what we're doing at our hospital, we're first of all asking any client that is showing signs of illness or anything like that to not come into the clinic, ask someone else to bring them, but to also notify us that there could potentially be a COVID positive person in their household. Then what happens that we do is we put on extra PPE, and then we bathe that patient with just mild soap. Because the coronavirus, even though it easily goes into body systems, like it gets into our nasal passages, things like that, it's easy to break down on surfaces. So skin, hair, tables, things like that, just really mild soap will break it down. And so that's why they ask you, to wash your hands for 20 seconds, and washing your hand is the biggest defense. So what I would say is it's not a carrier in the fact that it's spreading the virus through its secretions or anything like that, but it can carry the virus like on the hair coat and the skin and things like that. Same as like a coat could, or a jacket or a shirt or something like that. So the term I like to use is they can be a living fomite that can carry it. So with that, that goes with it. So if anyone in your household is showing signs of respiratory illness that could be related to COVID, same as the doctor would ask you to do for your family members, that is to isolate yourself in a room and not be exposing other people to it, we would ask you to do the same thing with your pet. So that's only if you're showing signs of illness, right? Because we don't want you to isolate yourself from your pets for no reason. But if you're sick and you think it could be COVID, keep yourself isolated from your family, and hopefully you consider your pet as part of your family, and keep isolated from them too, because that's the best way to keep them from getting the COVID. Okay. And then, so I'll just say right now, the greatest risk is human to human transmission. We know that, but we're learning more and more every day what species might be impacted by COVID, like who could catch it from us. There's a lot of different coronaviruses out there. There's a dog coronavirus that has nothing to do with COVID whatsoever. And it shows mild GI issues. If you're familiar with cats, FIP, or feline infectious peritonitis, is a coronavirus as well, but it is only seen in feline patients, right? And so corona is a big term for a lot of different viruses out there. And so don't want y'all to get confused about that too, because you might hear of a coronavirus, but if it's not COVID, this is the one that we're really interested in right now. And then, like I said, mild symptoms in animals right now that we're seeing, they seem to be resolving fairly quickly. There's one other thing I was going to tell you about. The Netherlands has a lot of mink farms there, and I know that they have 2 farms under surveillance because some of the mink are showing positive, but they also had a positive caregiver in both of those farms. And so we do think, again, it's passed from human over to the mink. So we're, like I said, we're learning every day new species that are popping up from this. And then as far as testing goes, we're only testing if we have very specific testing animals, if we have very specific guidelines, and we have to go through our state veterinarian to do that. And so it has to be that there's a positive person in the household and that this animal is showing signs of respiratory illness. And even then, they may or may not recommend testing at that point. So the tests are very limited. We think that they'll become more available as we go along, but we definitely don't want to take any of the laboratory space or knowledge or anything else away from the human side right now. It's so important that we get this under control on the human side that we're having to be a little more conservative right now on the veterinary side as far as testing goes. So if I could just, the biggest takeaway I would say from this is please let people know that there's no reason that anyone needs to give up their animals or anything like that of the risk of them giving a human COVID. We are seeing our shelters start to become getting more crowded and things like that. And some of it is over the fear of COVID. Some of it has to do with the economic issues that are going on too. But, you know, please help spread the word. At this point in time, there's no reason to be afraid of your pet giving you COVID. It would be the other way around. All right. And then my last slide is just a reference list of some of the places where I got some of the information, but also good places for you to go if you want to learn more about what we talked about today. So if you want to take a quick picture of that or anything like that, the One World Health and CDC website is just full of knowledge on all kinds of things, COVID, but also zoonotic diseases. All right, so I'll open it up to questions. Let me see if I can get to the comment box here, maybe. Oops, hold on, let me go back. Not sure.
And actually, Jenna, and at the top of your screen, if you want to go ahead and hit stop sharing,
Okay.
the view can pop back up. There it is to people.
There we go.
And then now, if you want to turn back on your cameras too, we can, you know, you can ask a question that way, or just open up the mics if anybody has any questions.
Jenna?
Yes.
A question. We had talked a little bit about possibly having some things to send to the students if advisors were interested, or any handouts, and then maybe questions that could be sent back for some loyalty award credit or something like that. Are you still thinking about that if anybody's interested?
Yeah, absolutely. I was kind of thinking, and I told Nita a little bit about this, but I was thinking about maybe putting together a list of zoonotic diseases, and then if we wanted to do a video conference like this and let them, like I could bring a case from our hospitals and they can kind of go through the list that they had ahead of time and try and figure out what might be going on with that patient, and you know, kind of some diagnostic tools and things like that. So if you're interested in that, let me know. But I can also get together for you. I think that got a sheet of all of the zoonotic diseases that are out there, and I can definitely send that out to you guys.
We'll it's being recorded, and we'll probably, if we get any feedback on that, I'll get with you on that too, Anita. And
any information, Jenna, that you do want to send in, just for everyone's reference point. I did mention that you know, we'd be recording this, but everything is posted on our New Mexico MESA website, specifically on our front page. There's a COVID resource page where we are putting links and recordings and information for all of our different sessions that will be up on our website for this. So anything you want to get to us, Jenna, we can go ahead and definitely put up.
Okay.
So a couple of other comments. Do you see your chat box, or do you want me to read them out?
Hold on. There we go. There's the chat. Okay, let's see. Yeah, so I think this is a great thing that you bring up here. It says, I wanted to mention that I wasn't able to adopt or foster a pet because there are so many dogs that are not fixed, and it's not an essential surgery here in New Mexico. That's what the shelter told me. So yes, different states have different executive orders. Thank goodness here in Texas, we were just, our elective surgery ban has been lifted, and so we are able to start back on preventative care type of surgeries and dentals and things like that, because our PPE supply, we know the good news is if for any reason they need to pull PPE from veterinarians to take care of the human side, they can do that at any time from us. And we're such a big company that we've actually been donating ventilators and masks and things like that. But in other states, and it sounds like New Mexico might be there, y'all are still under the only emergency or urgent care surgery. So I hate to hear that, because this impacts so many different levels. And I hope that gets lifted soon, because there's a lot of pets out there that need to be adopted. So a puppy on the street, is getting her puppy shots essential? I absolutely believe that is an essential service, because if you don't, the chance of getting parvo, rabies, and also, like we talked about, the deworming aspect of it, those puppies are so susceptible to disease that those boosters are absolutely an essential, or the shots are absolutely essential, and I believe deworming is too. And then the last one is there any animals that cannot get a zoonotic disease? I'll be honest, I am not sure about that. So yeah, I'm not sure. I don't know. What I'd say is, because, and it's funny because different viruses can go from, say from a cat to a cat, or a human to a cat, that type of thing. And the viruses are very specific on how they kind of jump from one species to the other. I think the other cool thing to mention about this COVID virus, I shouldn't say cool because it's just such this virus, there's so much to learn about it, right? But we don't even know exactly for sure where it came from. They're suspecting it came from a bat coronavirus that actually mutated and jumped to the human side of things, but they don't know for sure. And so I think there's just a lot of different things out there. So I see someone that says possums. So tell me, is that the case? Because I have no idea. I don't know. If that's the case, I learned something good today. So, and what I would say, I mean, when you think about like rodents, like rats and possums and things like that, they are very unlikely to carry rabies too. So very, very rare that they carry rabies. And you would think that like rats and things, squirrels and things like that would be high on the list, but they're not.
You want to mention the West Nile and the mosquito?
Yeah. So I don't know if y'all remember when kind of West Nile hit New Mexico, but I was still practicing there, and I was working on the first horse that I saw with West Nile. It was actually down. It was so neurologic. It was laying down on the ground, couldn't get up. And I spent a lot of time out there with that horse. And very shortly after that, I got really, really sick, like flu-like symptoms sick. And I didn't get tested for West Nile, but a lot of people kept telling me, I bet you have West Nile. But one of my good friends did get West Nile. He worked with livestock a lot, and he did get West Nile, and he's still dealing with those symptoms today. And so West Nile, that mosquito can go from the horse, or from a bird. It can jump species and then go over to a human and infect them too. So there is a West Nile vaccine for horses, and so that's a good thing there. And I think that we're going to have a vaccine soon for COVID in the human side of things, but it is going to take a little while because they have to go through all the studies and all of those other pieces to make sure it's safe for us.
Does anybody have any last questions? Or any other questions or comments?
Well, thank you guys so much. I really appreciate you having me on. Great questions. If others come up, please just send them over to Betty or Anita, and I'd be more than happy to answer them, and I'll try and get you guys some reference pages too. Okay. Have a good evening, you guys. Talk to you later.
Jenna, one last thing. If you can go back to sharing your screen and put up your slide, and then I'll put you on speaker view. And if you wouldn't mind smiling for a picture for documentation.
Oops, hold on. Let me just do this.